For many people, changes in leg circulation don't begin with severe pain. They begin quietly. Your feet feel colder than everyone else's. Your ankles seem a little more swollen by evening. Climbing the stairs leaves your calves unusually tired. Maybe you've even noticed that when you sit through a long movie or drive for an hour, your legs feel stiff and heavy before you stand up. Most people blame age. Some assume it's simply part of getting older. Others think the answer is to walk more, stretch once in a while, or ignore it until their next doctor's visit. But what if one of the biggest reasons your legs feel heavy has less to do with age itself and more to do with a part of your body that's working less efficiently than it used to? And what if improving that system doesn't always require expensive equipment or intense workouts? The answer begins in a place most people rarely think about: your calves. Many healthcare professionals sometimes refer to the calf muscles as the body's second heart. It's not because they replace your heart, they don't. Your heart remains the only organ that pumps blood throughout your body. But every time your calf muscles contract, they squeeze the deep veins inside your lower legs, helping push blood back toward your heart against gravity. That job becomes especially important the older we get. Unlike the arteries, which receive blood under pressure from the heart, the veins rely on several helpers. Tiny one-way valves prevent blood from flowing backward, and the surrounding muscles act like a natural pump. When those muscles stay active, blood keeps moving efficiently. When they stay inactive for long periods, blood can move more slowly, allowing fluid to collect in the lower legs and making your feet or ankles feel swollen, heavy, or tired. This doesn't necessarily mean there's a dangerous circulation problem. Many everyday factors can contribute to leg discomfort, including prolonged sitting, certain medications, excess body weight, dehydration, or chronic health conditions such as diabetes. That's why understanding what's happening is far more useful than jumping to conclusions. Consider someone like David, a 67-year-old retired school bus driver. After decades of sitting behind the wheel, he assumed the evening swelling around his socks was simply something everyone his age experienced. He still walked his dog most mornings, so he believed he was active enough. Then, during a routine checkup, his healthcare provider asked an unexpected question: "What do your legs do during the other 23 hours of the day?" That question changed the way he thought about movement. Many Americans meet the recommended amount of weekly exercise, yet still spend most of the day sitting. Researchers sometimes call this being active but sedentary. In other words, a 30-minute walk is valuable, but it doesn't completely offset 10 or 12 hours of sitting at a desk, driving, or relaxing in front of the television. That's where many people unintentionally work against their own circulation. The encouraging news is that your calf muscles respond remarkably well to regular movement, even gentle movement. You don't have to train for a marathon. In fact, for many adults over 40, small changes repeated consistently often matter more than occasional intense workouts. Still, not every exercise affects circulation in the same way. And one common habit that millions of people rely on may not be doing what they think it is. We'll explain why next, and you'll also see how a simple movement used by physical therapists can help activate the calf muscle pump safely for many people. Before trying any new exercise routine, especially if you have heart disease, diabetes, severe arthritis, peripheral artery disease, or another chronic medical condition, it's important to discuss it with your healthcare provider. And if you ever develop sudden severe leg pain, one-sided swelling, chest pain, or shortness of breath, seek immediate medical care rather than trying to manage those symptoms at home.